try and stick to our tact time
Okay.
so you can get back.
Good.
On your unit today, how many patients, families, or staff do you think are at risk?
We have a couple of patients that we're pretty concerned about. One because he's semi-one-to-one, very confused, and another one because we have some family dynamic issues going on with that patient. But we've already had our little conference. We have a daughter that's been very, very demanding, and there's a few little mishaps along the way that have occurred, and so physicians actually
So you have a plan in place to try
We have a-
and circle around.
yeah, we have the clinical lead, and Shayna's staying very close to that family.
All right. What about other quality opportunities or concerns?
Our biggest one with the physicians that are on this week is wanting to all round at the same time, plus having a resident, as we talked about yesterday.
Okay.
And so we had to intercede this morning because they all wanted the same nurse at the same time with the same pharmacist. So we did have one of the physicians go and see some other patients and come back in order to make that flow better. But
And
then
how did that interaction go when you asked them to go away and come back?
well, at first she said, I was here first. And then she said, so I tried to explain it to her more. She said, okay, well, I'll go see some other patients and then I'll come back. So she graciously, and then I told the other physician that she went and she'll come back so that you can all have the same team.
Okay.
Part of this is because the hospitalists have a smaller number of patients right now, so their census is down. So they don't have a whole lot of patients to
But
round
they have all
on
12
Friday.
patients here, so
Yeah.
of course they want to come, I mean, it's understandable, they want to come here at the same time, definitely.
And yesterday you told me you were having problems with a resident and that one of your hospitalists was going to intervene in that. How did that go?
Well, we didn't follow through on that because Dr. Turk gets her week off.
Okay.
So, but we'll talk through with her. And what it sounds like is that resident issue is specific to that resident in terms of where she's monopolizing the nurse's time and they're going in several times and there's some delays. Now, she did an admission today, and the nurse came out with some concerns. So it'll be very time consuming for them today. But we'll follow up with Turk when she gets when she gets back.
So there's a plan.
Yeah, but it's not. I mean, we talked about the residents rounding in general, and nursing felt like we can pre-huddle with them, but they really don't write a lot of orders. They're just looking for information, so we don't necessarily have to go in the room with them. So that's kind of how we're remedying it for now.
All right. Besides your family that he's meeting with right now, do you have any other patient or provider complaints?
The providers are continually complaining, of course, about not being able to round at the same time, but we're awaiting that, and that's been a kind of a continual issue. Depends on who's on. And we've got 2 incident reports that we're following up on. One related to a way an order was written and misinterpreted, so some contrast was missed.
Okay.
And another one relative to a report saying one side of carotid and the verbal from the physician was the other side. So that's the one that we're having the family issue with as well. So really some consults should have been done for surgery and were not done because there was a delay in clarifying that report.
So when that happened, how did you resolve that? I mean, that's a huge safety issue. You could have done a wrong-sided surgery. How did we resolve that?
It was identified fairly, probably mid-afternoon yesterday, and they resolved it by the evening, got the consults done, but still the test was done the day before, so it's probably a 12-hour delay that we should have had a surgical consult on that patient. It was simply, I mean, not simply, but the report said one thing, and then the physician got the other side in a verbal report, and that's what she went off of. It was incorrect, so.
That seems pretty time-intensive.
It was. It was.
Let's talk about people. Are there any staff on your unit today that you think have a problem or a barrier that would make doing their work today difficult?
What we've got going today, we've got small teams both for RNs, which is common because we have the plants on, so really our plant person probably needs the most support. But we don't have any CNAs today. Our only one on called in sick, so what we did, we had an extra LPN, so we have we made small teams. We tried something different today. Rather than having an LPN do the CNA role, we put small teams with the LPNs to match the RNs today. So the CNAs and the LPNs will do the CNA work along with their other work. So we'll see how that goes today. A bit more of a test.
Now, when you needed to make that decision, was that the two of you together? How did you, I mean, that's a big change to go from your traditional model to a different team model. Do you,
Actually,
Tina, do you feel like-
it was made more on nights.
Okay.
And then when I come in the morning, I'm usually here before 7, just before. So that's like one of the first things I do is take a look at it and I say, okay, what happened today? And it's, I got a sick call. This is what I was thinking. It's kind of like a verification before the 7 a.m. shift actually comes in. But they also do that with us, even bounce ideas back and forth. Like now, if something would happen for tonight, trying to figure out how would they do staffing, or even if we look at it tomorrow. So they've heard some of those ideas in the past.
So you have confidence and trust that this is the right, I mean, that's really neat. That's really working as a team, so that's really neat. Okay, what about physician or other leadership issues beyond what we've already talked about?
Nothing more than I can think of there.
Any staff or providers we should recognize today?
Well, I'd like to recognize the people who worked on a report project yesterday, because they are moving through, they just completed it yesterday, they're already moving through education today, and we'll have it tested again by this weekend. So that's pretty cool.
So what are you
really
going to
can
do?
make things.
How are you going to recognize them?
Generally, we do just a lot of verbal, good job on it. Let's see what's happening, that kind of stuff. So support more.
So they know
verbal.
that you guys are seeing what they're doing and that you appreciate it.
Oh, yeah. They worked in my office yesterday on it. Way to go!
It's a good. It'll be good. It'll really save us some time on report exchange.
Do you have any anticipated overtime or force overs?
We may have an extra LPN from 3 to 7, but one of them has volunteered to leave early.
Okay, great. Okay, let's talk about delivery.
Sure.
Are there any areas where your demand is exceeding your capacity?
Just our rounding demand that we already talked about.
How many beds are filled?
We're full
12 of 12?
at 12.
Okay. How many discharges are planned for today?
We've got potential of 5.
Okay. So you had 5 yesterday, 5 today. Is that sort of
Well,
an
actually, it went
average?
down to, we only had 3 then that went. So I'm actually giving you the potentials, and they don't all pan out. So I usually just change my sheet then to kind of get an actual after.
What's your mesh variation?
We are minus 0.8.
Excellent. Can't get much closer than that.
Nope, that's pretty good.
Good job.
That's pretty good. So we'll meet our hours, but our salaries, because we have LPNs doing the CNA role, will be up
It will
again.
be up.
Yeah.
So that will affect your
Yes.
financials. Okay. Will you have to defer anybody today?
We shouldn't, because there's plenty of beds other places.
So beyond the LPNs, is there anything else that will negatively or positively impact your financials today?
I don't think so. I think that's
Are you going to achieve your hours per patient day?
yes.
And what's your top priority for today?
I think it's the resolution of our 2 incident reports.
And how does that tie to your mental health?
Well, they impact length of stay and avoidable days.
Do you need any help from me today?
I don't believe so.
Excellent, thank you.